Let's start. Superficial palpation, you know it, yes? Deep palpation of intestine, you know it, correct? Sigmoid, circum, ascending, descending, you know it. Liver. First, we'll start with percussion. In real practice, we use often only lower body, but if you suspect liver pathology, upper and lower body too. This is topographic percussion, that's why we use quiet percussion. For superior border, 3 lines: right parasternal, right midclavicular, and right anterior axillary. Quiet intercostal spaces are steps. And this border will be inferior border of the lung. Yes, and after that border. And after that we'll count it. 1, 2, 3, 4. 1, 2, 3, 4, 5. It should be superior border of the 6th rib. It looks like. Inferior border of the 6th rib. It looks like 7th rib. It's close to normal. After that, inferior border. 3 lines plus mediana plus left parasternal. Oh, and after that border, it should be 10th rib. You can count it if you want. Oh, and border. It should be costal arc. I have 1 centimeter lower. And border. You will divide line between sternum and umbilicus by 3. 1, 2, 3. Border should be in the point between upper and middle line. I have lower. Maybe. Oh, slightly lower than this point. Clear? And after that, costal arch left. And border will go to left parasternal line. Lower, upper. Why it's so important to know lower border? Because when you start to palpate, you'll go 1 to 2 centimeters under this, down from this border. That's why if you have liver enlargement and you'll stay here, that's not palpation. You have to stay under this edge of liver. After that, fingers. And after that, what's the idea? You can breathe sometimes. Fix you. I want to have a soft abdomen, and you can breathe with open mouth. 3 steps. Do you remember intestine 2 steps? Here will be 3 steps. This is liver edge. Breathe in, and liver is coming down together with your fingers. Breathe out. Liver is coming under the costal arch, and your finger are going under the liver edge. And once again, breathe in, and you will palpate it. Breathe in, breathe out, breathe in. Clear? You can breathe. Do you remember here is border? That's why I'll go centimeter down. Breathe in, abdomen is coming up. Out and in. Oh, that's good. Out. In. Out. And in. Once again. And once again. Breathe in. I'm closer to costal out. You can breathe. And after that, palpation. I didn't feel. That's why liver is sitting under. Once again. You can breathe normally, but abdomen should go up and down, up and down. And once again. You can breathe at normal breathing. I will walk with your abdomen and you are breathing, that's all. Breathe in. It's not painful. Out. Breathe in. And once again. Once again. And then, no, I think we were sitting under. That's why this percussion was not so correct, because I didn't feel it. Do you understand? This is palpation. Now spleen, closer to me. Same story, but we have small trick. If you have patient, for example, you suspect hematological disease, you suspect liver pathology with hepatosplenomegaly, you suspect enlargement of spleen, what should you do? You start to percuss when position of patient is supine. Because if spleen is huge, and you will use at this moment lateral position, and you'll start to palpate, it's the same story. You will sit on the lip, on the spleen, but spleen is bigger. That's why position of your finger. That's why first point you percuss when position of patient is supine. You'll go from umbilicus to the to direction of 10th rib. Quiet percussion. Maybe. You see, I know spleen is sitting under the costal, under the ribs. What does it mean? Lateral position. Lateral position. Look at me. No, you fix with this. Why? You have soft abdomen. And now percussion. Nothing. No tympanic, still tympanic. Normally it should be level of 10th rib, 1 centimeter externally from anterior axillary line. Or maybe here, but I cannot find it. Oh, tympanic, still tympanic, you see. That's why, what should you write in your case report? We didn't find it. Posterior, from scapula to the level of 10th rib, because it should be horizontal size, and after that vertical of the spleen. Not clear. I want to have dull sound. That's why I didn't find 2 points. Now, mid-axillary line, superior point. Not clear. What is it? Bubble is sitting. You see? It's tympanic. It's not dull. What is it? Resonant with lungs. It's tympanic. It's not dull. Level of 9th rib. And last one. I'm not clear. It should be level of 11th rib. That's why 9th, 11th, anterior, posterior, vertical, horizontal size of the spleen. Do you understand? Yes. In practice, it's easy today. If you are not in the forest, yes, you are in the hospital together with your patient. Ultrasound, it's easy to find it. Do you understand? If you have problems with percussion. Questions for percussion? No? Palpation. Both hands, same story. Once again, costal arc and palpation of liver. You fix it. Now lateral position, same story. You fix ribs, breathe in, breathe out, and breathe in. And we cannot palpate. Once again, breathe in, breathe out. I'm going under the costal and breathe in. His abdomen can push my fingers out. And if you have enlargement of the spleen, I will feel itch. No. We didn't palpate spleen. Is it normal? Yes, this is normal. Do you understand? That's all.
Maybe first in palpation, how we place our hands
Breathe in. Skin movement to umbilicus. Out. I'm going under the costal arch, and after that, breathe in. I'm coming together with the abdominal wall.
Should we keep a whole hand or only fingers?
Fingers.
Is it parallel to the costal arch, madam?
Once again,
Parallel to the costal arch?
I will go under.
Okay.
And
Once again, breathe in. Out. Breathe in. More intensive. Out, and you push my fingers. Breathe in. Out. Breathe in. Breathe in. Okay, that's all.
Madam, can you do the percussion of ascites fluid?
Yes. How can you do it? You will go from tympanic to lower parts of abdomen. You have dull sound. After that, it's possible to, for example, this is level of the fluid. Come here, this lateral. This is level of the fluid, or like this. Yes, after that, let's start again. This is level of the fluid. What does it mean? When we change position of patient, fluid is coming to this side of abdomen.
If there is no change, we have to say abdominal obesity.
Oh, many details are there.
Yeah.
First of all, shape of umbilicus. After that, this sound, we have tympanic only. And last step will be ultrasound. If it's not clear, we can check presence of fluid. Of course. And if we are talking about liver pathology, that's not enough. Fluid, diameter of vena porta. If it's big, what does it mean? It's portal hypertension. This is a sign of portal hypertension.
And madam, percussion of relative heart dullness. First, we percuss the inferior border of the diaphragm. So if it's upper,
Yes, it depends. What
yeah.
does it mean upper? For example, you percuss this size, this part of the chest, and you have dull sound at the level of third rib because of something. Because of
so we cannot.
no, we cannot.
We
Because
cannot
we
get
cannot percuss relative heart dullness.
heart dullness of the right side or anything.
Only right.
Only right. We can do it.
If you have something wrong here, maybe left too, but that's not in practice. If we are talking about fluid, fluid is staying laterally or posteriorly. It's not possible to have level of fluid here.
So we can percuss relative heart dullness in left side, not in right side.
Yes, if you have a special situation. What do you think? Why we have these special rules for percussion? Because it's practice. Somebody said it's possible to use something like this. It's simple, easy, not many steps. Because, for example, if you open first books for percussion, maybe not first, but last century books, you can see many variants of percussion. For example, lungs percussion, intercostal spaces. Next variant,